Have you ever wondered where is the healthcare industry going? Not necessarily in the next 2 to 3 to 4 years, but where is it going the next 5, 10, 15, 20, 25, and 30 years? What is the trajectory of healthcare in terms of what you can expect to gain from United States healthcare in the future? Well, one of the things I like to do is I like to take a step back and analyze specific data sets that cover specific areas of the United States healthcare market and the globe. And so, in this specific analysis, I decided to bring in US healthcare expenditure data on a global basis and then compare that and bring in census data that can give an understanding of not only where healthcare expenditures are at a global level, but how they apply to individuals on a individual basis as far as their age group, what services they have, where the payers are, and what their costs are over time. One of the things I enjoy about this specific data set is that CMS.gov was able to provide total US health expenditures, regardless if it is Medicare, Medicaid, private, other, etc. And so I was glad to have that and then match that up with census data to get a per capita number that I think is really indicative of where healthcare is going and the expenses and expenditures for healthcare. So, with all that being said, let's dig into it. Now, with United States healthcare expenditures, I first wanted to start by analyzing what are the total expenditures within the United States overall. And so, in the top left chart, you will see that total expenditures by year has gone from 1.4 trillion in 2002 to 3.4 trillion in 2020, and it's approaching 4 trillion as of 2024. What this means is that not only in the last, let's say, 20 years, the total expenditures within the United States healthcare market have more than, let's say, nearly at more than doubled at the very least and almost tripled. What it means is that that expenditure amount goes up in dollar terms by a very, very large rate. This is no surprise for a lot of reasons that we'll get into. But one of the things I'd like to help you understand is trillions of dollars is hard to kind of wrap your mind around. And so one of the things I like to do is have in my head some comparisons for trillions of dollars that make sense. And so one of the just top round ballpark numbers I like to use is that the United States, in terms of taxable income that the United States brings in taxes, is around $4 trillion. Just a couple weeks ago, the United States had to pay in interest payments for the debt that they have on hand $1 trillion per year. And so once you understand the large amount of money that is being used in trillions of dollars, if you can find comparisons, then you can kind of understand, okay, the United States healthcare industry is a behemoth. It's huge. It's as big as what the United States government brings in terms of income, although the United States is spending at a government level about $6 trillion. So the United States is spending 6 trillion more or less, depending, and the United States healthcare expenditures is 3. What this means is that as United States healthcare expenditures increases, the burden on, let's say, government programs that include healthcare also goes up drastically, and we'll touch on that on other pages within this analysis. I also wanted to know just more or less, instead of just the top line number of total expenditures, what's the expenditure by age group? And so as you can see, total expenditures for the ranges of 45 to 64 and ages of 65 to 84 are by far the largest in terms of raw expenditures, to where you will have 65 to 84 and then 45 to 64, both using and or expending $1 trillion in the healthcare industry as a whole, which is quite astonishing. One of the things I will note here is that the retirement age individuals of 65 to 84 are at a point to where their expenditures as at an aggregate level is larger in 2024 than the age group, which is your working age population of 45 to 64. And so you have more expenditures going and or approaching those who are in retirement age than those who are in working age, um, in that prime working age, which is 45 to 64. Now that we understand that, we also wanted to identify, and I also wanted to understand, okay, what's this percentage change? Meaning, what's the growth rate of expenditures over a year basis? And so, as you can see, the difference between male and female is seen at this chart low down below here. But you can see that the men essentially have a higher rate than women as far as their percentage change. And so, although you can see here that women spend more in healthcare than men, the percentage change in expenditures, meaning that on a year basis, they're paying more and more than women are on a percentage change basis. But one of the things that you will see throughout these charts is this U-shaped pattern, to where in 2004 it was essentially a 8% year change, and then it dropped down to where you have between a 4 and a 5% change, and then it coming back up in 2020. Those reasons, I would say, are probably various that we will probably cover in other pages within this analysis. Lastly, I wanted to show by age group what are the total expenditures for men and women. And so 0 to 18 and 85 plus, of course, are not using as much expenditures or not having as high of expenditures as other age groups, especially within the 45 to 64 and 65 to 84. The difference in the 19 to 44 is that women obviously are at an age to where they have children, there's family formation or household formation, and then men usually don't necessarily need healthcare between their 20s and, let's say, 30s, typically, but it just depends on the individual, of course. But on an aggregate level, you can see this difference here. One of the things I find interesting is, though, although you have this big difference here that kind of makes up for a large difference in expenditures between men and women, the percentage change is one in which the expenditures for men are increasing faster than women. And I wonder why this is the case. One of my hypotheses is that women are having less children. And so because of that, the share of men who are using and or um, are being allocated within the healthcare industry is greater. And so if you have men that have a greater piece of the pie than they used to, then you will have a higher expenditure percentage change, which you will see here. I don't know if that's the case. That's a working hypothesis. The other hypothesis is that men in their later ages, 65 plus, obviously would have a greater need and or a greater need for these cares, especially when it comes to 85 plus. These are just a few theories that I have rolling around in my mind that I thought I should add to the conversation. But this in total is US health expenditures. And so healthcare expenditures as a whole has certainly increased greatly. And you will see that from the early 2000s to 2020, it has exploded higher. There's no surprise here at all. It's just when you dig deeper, you can start to understand that it matters when you talk to different age groups. Now, when we talk about the United States population, it presents an entirely different story. And this population data is coming from the US Census Bureau. So, of course, you will see in many cases a US population pyramid. And this is common for you to understand what the population of the United States looks like on an age by age basis. So, if you can see, the United States population looks pretty much like a square, meaning that the younger ages are supporting the older ages, but it's not so out of whack where there is drastic amount of people who are older than those who are younger. And so if you look at, let's say, a population pyramid for Japan, or now approaching China or even Korea, you will see that there is a bulge up at the top here, to where those who are older have a bigger population percentage than those who are younger. And so, pretty much between Gen X, the baby boomers, and millennials, it's pretty much all the same. And I have some numbers to prove that here, to where um, for the baby boomers, what I found that baby boomers now have 68 million people within their baby boom population. Um, Also, the median age of a baby boomer is 68, meaning that baby boomers are very much squarely in the I'm retiring part of their life. Gen X, on the other hand, has 65 million, so only 3 million less than the baby boomers, and their median age is 51. So I take Gen X to be the kind of generation that now is in a place to where they're just essentially counting down the years to where they can retire. Some are approaching, the 60 age mark, and some of them are on the earlier side, meaning they're at, like, let's say 48, 49, but they still view themselves as their career is kind of hitting a peak, and they're deciding, okay, do I take a second career? What do I do with retirement? Those kinds of questions are now being asked by Gen X. The millennials now are now taking a large percentage of the share in terms of their spending power, earning power, and they are now the largest generation in the United States at 71 million. So really, they're 4 million greater than the baby boomers, but their median age is 37. And so the millennials are sitting in a place to where they're past their 20s for the most part. They're now squarely in their 30s, and they're now having a trajectory of 20 years to think in the future of, okay, what do I want my work to be like? What do I want my life to be like? And presumably, most of them have the tools, education, etc., to be able to provide them with the foreknowledge in order to make that next 20 years happen. And so, even though millennials are very much in the driving seat, the baby boomers and Gen X are certainly within the same range in terms of population, as the rest. And so within any workplace, you'll have a mix of all three generations, really more or less Gen X and millennials, but then baby boomers who are, let's say, at the higher levels within an organization, still guiding a lot of the decisions. Now, Gen X or Gen Z, on the other hand, is a little bit smaller than the millennials. So Gen Z is 69 million. So only 3 million less than millennials, and their average age is 25. So Gen Z is now getting to a place to where their careers are starting as fledgling as they can, and they're now at a place to where they're exiting college and now trying to enter the workforce and enter the life, just the life of 20s and 30s, and trying to tool up. And so it's difficult for Gen Z because the millennials essentially have essentially dominated the market for 10 years, and now come Gen Z, and they're trying to make room within this already competitive economy that's the United States and the global market. Now, okay, so essentially you have roughly the same population for the baby boomers, Gen X, millennial, and Gen Z, and they're all pretty much the same. But one of the things that nobody is talking about is that Gen Alpha, which is the upcoming population and or the upcoming generation, what do they look like and what does that look like? And so Gen Alpha is projected to have a population of 45 million. And so, just to give you an idea, if millennials have a population of 71 and Gen Alpha has a population of 45 million, that's a huge difference. That's a difference of, let's say, 45. It's a population difference of a little bit under 20 million. And that's a huge difference, because what that means is that as the millennials want to retire, and as they are approaching the ages of 65 and plus, they will rely on Gen Alpha to then be able to support them in healthcare, support them in all of the other ways. And there's not, presumably, not going to be as many people in that Gen Alpha generation to be able to support millennials and Gen Z. That's kind of opposed to the baby boomers, where the baby boomers now are sitting really nicely, where they have Gen X that's coming in behind them, and then millennials who are then filling in the gap. And so millennials are sitting in a good place, but then as Gen Alpha comes up, the projections for Gen Alpha in terms of numbers are not looking as well as really anticipated. And so that's a huge population problem that the United States is going to have to overcome, especially within healthcare. Okay, so with all that being said, what is the population by year and age group? And so on the top right here, you will see that really it's pretty much even to where the population age group for those who are 65 to 84 is growing, and the population age group for 45 to 64 is growing. The interesting thing about age groups is that they not necessarily correspond with where generations sit, right? Because a generation can span 20 years, but it can straddle two different age groups. And so you can have, let's say, like you can say, for example, Gen X, you can straddle between, let's say, the 19 and 44 and 45 to 64. If you have, let's say, I don't know, 47-year-old who's in the early range for 45, but within 64, that's really more or less approaching baby boomers. The same with millennials. You know, most millennials are within the 19 to 44 age group for sure. But then Gen Z is straddling that 19 to 44 and 0 to 18. And so that kind of provides some insight into, even though I'm talking on a generational basis, these age groups certainly increase and decrease depending on who enters that age group. So as you can see, age groups that are growing are the ones that are 45 to 64 and 65 to 84. Um, and the population for 19 to 44, which is your prime working age population, is decreasing slightly, where before they took up 38% of the population and now they're taking up 34. So it's a slight decrease of 4%, but it matters over time. Also, those who are 0 to 18, it was 27% in 2000, and today it's sitting at 22%. So still a 4 or 5% decrease, but once you add them up on aggregate, it makes a bigger difference. One of the most interesting insights that I found was just on a year over year population growth change. In 2001, you had a population growth of 1%, meaning that every year the population got 1% bigger in terms of US total population. Now, in 2021, the population has grown by 0.12%. So the population growth is less than 90% of what it used to be 20 years ago. And that's really astonishing, because what that means is that it kind of proves out what the projections are for Gen Alpha to not be as large as the other generations for a variety of reasons. Another thing I want to show and I want to blow up here is the fact that you have an age group of 65 or 45 to 64, and you have the age group of 65 to 84. And so, what is their population and where is it going? And so, if you look here, you have population growth to where those who are at 65 to 84 is growing, and their population growth is growing, while you have those who are within the 45 to 64, they're decreasing. And so the age group of 45 to 64 has decreased to a point to where it is now shrinking in terms of that age group. So the only age groups that are really increasing today are the 65 to 84 and the 45 to 6. And really, it is only the 65 to 84 and the 85 plus. And so those who are in retirement age or above, their population is growing to where those who are 19 to 44, it's really evened out, and then all the others are shrinking, which is really, really shocking. But when you think about it, since people are getting older, then you have that older age group that is growing faster, and then you have the younger age groups that are actually shrinking. And so you will have fewer population within the 0 to 18, and you'll have, let's say, leveling out from 19 years old and plus, until you get to 65 to 84 and above, to where that population is growing, partially because the baby boomers are now entering that age group, and Gen X is now really close behind them in terms of population. So this is the United States population from the US Census Bureau. And in the next pages, I will then combine them together to get a per capita basis. But at least here, you get an overview of what the United States population is And once you understand it in terms of healthcare terms, then you can start to put real numbers and real expectations on what you can expect from healthcare in the next 10, 20, or 30 years. Now we're getting to per capita expenditures. And so if we have total aggregate expenditures on one end and you have US population on the other hand, then you can join this up by age group and for male and females, and you can get a better picture of what are the total expenditures and break it down at an individual per capita basis. And so like we showed before, as far as total expenditures going up, on a per capita basis, it of course is going up because you have expenditures that are growing faster than the population. And so in this case, on a total basis, in 2002, the expenditures on an annual basis was 4,000, near $5,000. Now today, the expenditures are $10,000 roughly. And so what you can see is that the total expenditures per capita also doubled. And so if you have 4,000, let's say for on a total basis, 4 to 5,000, then you get to 10,000 here, then your expenditures have doubled. And so what can you expect for the next 10 years? You can at least expect for the next 10 years for your expenditures, or even on an aggregate basis, for expenditures to then double again at the very, very least. And I would expect it to more than double because you have the baby boomers entering an age where they need more health care. Now, what does this mean on an age group basis? And so, if you can see on an age group basis, those who need or use um, more health care on an age basis are those who are 85 plus. And so, if you go back, even though on an aggregate level, those who are 85 plus don't use a large percentage of expenditures, on a per capita basis, they do. And a lot of times it's because they're entering the last years of their life. And so that's where the most expenditures take place. Another surprising thing is that for the age group of 65 to 84, it's also growing. So the per capita expenditure is also growing, even though it's hard to see on this graph. What you'll see is that a per capita expenditure in 2002 for 65 to 84 was 11,000, and then here it is 20,000. So there again, you've got a doubling to where your per capita expenditures doubled. For really any age group. Those age groups down below, which are the 0 to 18 and 19 to 44, they on a per capita basis really don't have much expenditures. But still, let's say if you're between 19 and 44 and you're spending $3,000 in 2002, in 2020 you're spending $6,000. And so again, it's doubled, even though it's not as high as those within other age groups. If you want to see this in total, I created a table here that can help you see the numbers in a better way, or just more accurately than just ballparking or just looking at one of these charts. Lastly, on a per capita basis, I wanted to see with a snapshot of 2020 what an individual can expect as they get older. And so you can see that if you're 0 to 18, then your expenditures will be around $4,000. By the time you're 85, you're at $35,000, $36,000. And so that is huge, because what that means is that there's probably like 4 times 8 is 40, 4 times 8 is 32, right? And so you can expect between ages of 0 to 18, you can expect to pay 8 times as much when you're 85 plus. Likewise, if you are 65 to 84, then there's a huge bump when you're 85 plus. And likewise, when you're in retirement age, you go from 12,000 to 20,000. So that's nearly doubled when you go from your prime working age to retirement age. And this is something people don't plan, but it's very much in the data, which I found very interesting because, hey, I'm sitting here within the 19 to 44 range. And so what I can expect when I reach 45 to 64 and then retirement age is that my healthcare expenditures will increase, and not increase in a small way linearly, but increase almost exponentially and or drastically. And so if I'm spending, let's say, $5,000 to $6,000 when I'm 44, when I enter, let's say, the 45 to 64, then I can expect to spend twice as much. And then it doubles again almost when I am in retirement age. And then it goes up, let's say, I don't know, 30 to 40% more when I'm 85 plus. And so it ratchets up as you get older, and nobody really tells you that. And I really didn't quite understand it until I looked at the data to understand how that worked. So this is a per capita expenditures where we're taking total aggregate expenditures from CMS.gov and then matching that up to census data from US Census Bureau and getting a good idea of what per capita expenditures are by age group and then by male and female and then on an aggregate basis. Now I wanted to know what's that percentage change because my thought is like, okay, I understand that these are increasing, but how much are they increasing on a year to year basis? And what has been the trend since the 2000s up to, let's say, today or the latest that we can get the data? And so if you remember in the earlier ones, I had that U-shaped pattern for percentage change, and you see this U-shaped pattern here. And I will say that if you look at any index in terms of any index that is talking about inflation, you will see that there's a low point in the 2010s. But I would tell you that the low point in 2010s is not 3%. The low point is like 1% or 2% of, let's say, stated inflation. But what you will see is that within healthcare, inflation and or the percentage change in expenditures is a lot higher. And so in my mind, when I think of percentage change, I'm really trying to compare this to what people say inflation is and or what that change in expenditures is so that I can get an idea of how much on a year-to-year basis I can expect healthcare to increase. And so I know that in the past 2 years, it's been essentially a 4 to 5% increase in terms of my premiums, right? And so this kind of falls in line with what happened in 2020, and I can understand that, hey, in let's say the 2010s, it really hovered around 3% increase. And so maybe we ratchet it up from a 3% increase year over year to a 4 to 5% year over year in the 2020s. And so you will see that here as far as the U for male and female as well, whereas in 2020 there was a huge discrepancy between men and women, where actually men had a larger per capita expenditure change than women did, which I found was very interesting. Now, if you break it down by age group, it also tells a very, very interesting story because what this means is that if you have age groups that sometimes their year over year change can be the same or negative. And so this is what you will see for those who are 85 plus, that in 2012, their expenses or expenditures they decreased by 0.27%. So they essentially stayed the same. Likewise, in 2014, you had for those who are in retirement age of 65 to 84, it went down by 0.5%. And then likewise, within the 85 plus, you had it go up by a small margin. Now, I would say there's probably a lot of reasons to that, but one of the things that I will note here is that Obamacare came in within the within the 2012 to 2014 to 2016 range, and then it changed in 2016 when let's say healthcare regimes changed, and it kind of made it to where some different policy changes made it to where it spiked up in 2016 and then kind of returned to that U-shaped pattern. I'm only going to note that here because I think that's important to note as far as these negative amounts, also understanding that also inflation was low at that point. But that drastic increase from 2014 to 2016 is also notable because there was a regime change in terms of healthcare and the way that people were trying to use their funds and allocate resources to healthcare in different ways. So this is per capita expenditures. I hope that helps you understand what this U-shaped pattern means. Although I will say that it's higher than whatever is stated inflation. And in the future analysis, what I want to bring in is I want to bring in that top line and healthcare allocation for the percentage change that they have for inflation. And then I also want to bring in the gold price as far as something that can give you a real basis for what that inflation percentage change could be. So that's a future analysis. I'm not going to show it here, but that's something that I thought about that would be easy to bring in to these two existing data sets. Now we get to health expenditures by service. So I not only wanted to show what health expenditures were in terms of total and on a per capita basis, but I also wanted to kind of provide information and break it down by service. And so what services are being provided within healthcare and where are expenditures going? And so if you will see here, the largest expenditures are hospital care, um, then followed by physician and clinical services, um, and then prescription drugs, etc. And so you can kind of see that here. As well as if you see it by service and payer, you can see that hospital care is by far the largest, physician and clinical, then prescription drugs. But the payers in terms of this is private health insurance for hospital, physician and clinical, and then prescription drugs. So in other words, private health insurance is taking a large share of these expenditures. On a per capita basis, this is what it looks like to where you will see that when you age, you are using different services as you age. And so to blow this up so that you can kind of see it, what this means is that these two up here, which are nursing care and which are hospital care, they increase drastically from ages of 65 to 84 and 85 plus. So that when you're 85 plus, obviously the largest service that you are going to need is nursing care facilities, and you're going to need hospital care. But there's a large trend upward from, let's say, 45 to 64 to 65 to 84 in terms of that hospital care that you need. And so hospital care is certainly very much expected, but then the one thing that I didn't quite understand but is well articulated here is that when you're 85 plus, that nursing care is certainly a large expenditure for that age group. Likewise, what also you will see is the green line here, which the green line really represents prescription drugs, is pretty much level and levels out after ages 45 to 64. So prescription drugs level out, and then when it comes to what also those who are 85 plus need is home health care, and that kind of provides a clear picture of retirement age and those who are 85 plus, and the services that they need. Now, if you wanted to see the per capita change by service, I would encourage you to, when you get access to the analysis, I will put a link in the description for you to get an access to it and kind of explore this entire analysis for yourself. But you can kind of see, and you can kind of drill down into different ones, like you can even look at dental service. What's the percentage change for dental service? And on an age group basis, who's using the most dental service? But really, we want to look at physician and clinical, hospital care, and then we also want to look at, let's say, prescription drugs. And so the top three, you can kind of understand that the percentage change is pretty much the same, except for in 2020, you had a decrease in cost for prescription drugs slightly, and then it came back to its normal, percentage increase. Also, you can kind of get a better sense of what the three hospital care, physician and clinical, and prescription drugs, how much they're needed and or the expenditures for them as an individual ages. And so I'd encourage you to kind of take a look at the analysis. We also break it down by age group so that you can look at, let's say, specific age groups and identify it by age group as well as by payer. Now we get to healthcare expenditures by payer, meaning who is paying for what. And this is important to understand in the context of everything else because you not only understand what the expenditures are on an aggregate level, on a per capita basis, and the services that they are using, but who is paying and what age groups are paying for what, and what is the breakdown for health expenditures. And so, if you can see here, you have total health expenditures by payer. And so, as we stated previously, private health insurance is for sure taking up the largest share in terms of their health expenditures and what they're paying and contributing to healthcare. Secondly is Medicare. And then thirdly, now is other payers and programs. And then it is Medicaid. And then it's out of pocket very last. One of the very surprising things is that this change, as far as the top three, really didn't change with private, Medicare, and then Medicaid, except for there was a change between 2018 and 2020 to where other payers are now paying more and contributing more to healthcare than they did before, which is a huge change. And it's interesting because from 2018, Medicaid essentially paid and or contributed in terms of expenditures $500 billion. And then it almost increased by, let's say, I don't know, from 531 to 587. So that's $50 billion. So Medicaid increased $50 billion, but other payers and programs has certainly been on the rise and been increasing drastically. So I could do an entire other analysis on what this other payers and programs is, but I wanted to note it here because that is a trend that has started and grown very slowly, but now is very much in that case. One of the other things I will say is that I know people who not only have private health insurance, but then also use other ways to pay for healthcare on top of their private insurance. And so it's not that, let's say, people are choosing one or the other, but they're augmenting in ways that they feel like is best for them. You can also see this on per capita expenditures percentage change by year, to where what is the percentage change by year and what does that look like? And so if we want to look here and let's say we want to look at, let's say, Medicaid, Medicare, and other payers, um, you will see that there's a huge increase from 2018 on a percentage change basis to 2020, to where it went from 4% increasing a year all the way to 20% in 2020. So I would say that from 2020 to 2024 now, that change isn't as great, but I would say that it's still great, and I don't think that this other payers and programs is going away, partially because there are individuals who need a greater way to augment the way that they are now paying for healthcare. Another thing I will note is that private insurance is paying for most, and most of it is going to hospital care and physician and clinical services. Medicare is more likely to pay for hospital care, physician and clinical, and prescription drugs. Other payers is very much in the hospital care, physician and clinic, and then down the line it goes. And so this can kind of help you understand where paying and or payers are going. And lastly, I'm going to show you on a per capita expenditures by payer. And so here it kind of gives you an idea that for 45 to 64, most of them are using private health insurance. But by the time they're in retirement age, they are essentially switching and or allocating more expenditures to Medicaid and or Medicare, um, in this specific range, because Medicare is essentially being used a lot of times for those retirement ages. So Medicare, you've paid in for the entire life, and so baby boomers are now cashing in and decreasing the amount that they are using private health insurance. And this is very notable here, to where those who are 45 to 64, working age, standard to have private health insurance with your company or whatever. And then when they're in retirement age, then they reallocate and they can now take advantage of Medicare, and they're doing so greatly even those who are 85 are doing so greatly, but also those who are 85 are taking care of or taking use of Medicare and Medicaid, and then also are paying out of pocket. To those who are 65 to 84 in retirement age, those individuals are certainly now switching to Medicare, but but they are also just using a different share down below here to augment that Medicare. So I thought that was very interesting and a trend that I wouldn't have identified as far as those who are within that 65 to 84 using Medicare a lot more, but it makes sense because they paid in for the rest of their lives and then now they're now reaping the benefits of that. What I will say is that when talking about the projections for Gen Alpha, that makes a big difference because essentially every paycheck that is going to pay for Medicare is essentially out of like hand to foot, meaning that every let's say out of every pay stub that an individual pays who are in the 45 to 64 or younger, they're paying into Medicare and Medicaid, and that is going directly to baby boomers. And so if millennials now get to retirement age and there aren't as many people paying in, well, essentially, millennials can expect not to have a large percentage of their expenditures be in Medicare and Medicaid, and will probably still opt in to private health insurance out of pocket and other payer and programs. And so, this is where I think in the next 10 to 15 to 20 years, other payers and programs and out of pocket will take a large percentage, including private health insurance. The other thing I'm seeing within the millennial generation is they're finding alternative ways to get health care. And so, for example, I have a friend that he's taking a trip to Mexico where he has family, etc. And so he is essentially taking a vacation there, but is also going to get an MRI and an x-ray on his ankle, where in the United States it would have cost $1,000, to where in Puerto Vallarta, where you can have a good time, it costs $150. And so why not pay $400 for a ticket, get an MRI, spend a weekend at the beach or a week at the beach, and then come back to the United States? And so a lot of millennials are trying to find creative ways to utilize the health care that they have accessible to them and be able to be creative about it because they know that in the future, healthcare as it is may not be as robust as it is today. That's a topic for another subject, or a subject for another day that I will cover. But I also wanted to note it here that this trend of those who are in retirement age taking advantage of Medicare and Medicaid may not hold in the next 10, 15, 20 years for a given number of reasons. Um, and so this is where I want to leave it as far as health expenditures by payer, but is also a very important piece to the entire puzzle of US healthcare and the expenditures and on a per capita basis. So now that you understand all of this, I hope this helps you kind of get an overall understanding of where expenditures are going at an aggregate level, their growth, how it compares to on a per capita basis using census data, and then who's paying for what, and then what services are being provided, and the percentage change of what expenditure changes over time and what you can expect, let's say in the next 10, 15 years of health expenditures going up. And so the question is, as health expenditures, let's say, increase at a 5 to 10% basis year over year, what does that mean, right? And on a generational basis, what does that mean as well when you have more baby boomers and Gen X reaching those later years and millennials also getting older? Who's going to now fill in the gap? And what does that look like on a generation and population basis? These are big problems that not every individual can solve, but I found some interesting insights in this information that I wouldn't have been able to tell you if I didn't look into the data. So thanks for watching this specific analysis. And if you want access to it, below in the description is a link to a page on our website where you can use and you can see and explore this specific analysis. And you can go to the sources that we cite there, and you can go specifically to the data that we're using. So I hope you enjoyed it, and I'll talk to you next time.